Hello, wherever you are in the world, wherever in the world you are joining us from today. You think I'd get the first sentence right, wouldn't you? Welcome to this online session hosted by the Nursing Now Challenge and supported by the World Innovation Summit for Health. I'm Nick Bradshaw, the Director of Partnerships and Outreach at the World Innovation Summit for Health, and it's my sincere pleasure to introduce this event, which is held as part of the latest Nursing Now Challenge Global Solutions Initiative, focusing today on nurses' pivotal role in global climate action. We'll be hearing from some great speakers today. But first, a quick reminder of the initiative that brings us all together, albeit virtually. The Nursing Now Challenge Global Solutions Initiative was launched last year to provide a platform for nurses and midwives to showcase their innovative ideas and leadership skills. By submitting a solution to a challenge, you join a community of nursing and midwifery leaders driven to make real positive change to improve care and address ongoing global health challenges. Now, details of how to submit a challenge can be found at nursingnow.org, the Nursing Now website, which we encourage you to go to after this session. But essentially, participants are expected to produce a short but detailed concept note that outlines a problem and then suggests a solution to that problem. So if you want to take part, you can enter as an individual or as part of a small team. This summer, 2 challenges are running. The first focuses on the role of nurses and midwives in addressing climate change. And then the second explores the role of nurses and midwives in driving digital health. My organization, Wish, is delighted to be sponsoring these 2 challenges, and we're offering $1,000 to the winners to help them develop their idea, as well as offering the opportunity for them to present their idea at Wish 2022, which is Wish's next global gathering of healthcare leaders, practitioners, researchers, and innovators, due to happen in 2022. Who knows what happens these days with years? We have a football competition, Euro 2020, happening in the middle of 2021, but hopefully Wish 2022 will happen in 2022. So let's get going with today's session, which focuses on the role nurses can play in combating climate change. Climate change is a problem that affects everyone, of course, and it's a challenge that nurses can have a role in addressing. Over the next hour and a half, we'll hear from a range of speakers, including experts who highlight the challenges that need to be overcome, specifically those challenges where nurses can be a real part of the solution. We'll hear from a panel of great young nurses, and we'll also hear from an entrepreneur who's managed to turn an ecological problem into a way of securing healthcare for those members of his society who would otherwise struggle to receive care. So all really interesting stuff taking place during this session. So later in this session, we'll put some questions to today's speakers. So if you want to take part in that, please use the Q&A function if there's anything at all you'd like to ask. So I think at the bottom of your screen, you'll see Q&A. If you click on there, you can add questions. We'll shortly hear from the lead author of a new BMJ report and from a representative of the Lancet Countdown on Health and Climate Change. But before all of that, let's now hear from our first speaker, Katie Hufflin. Katie is Executive Director of the Alliance of Nurses for Healthy Environments. Thanks for being with us, Katie. Really, without further ado, I'm going to hand straight over to you.
Thank you, Nick, and thank you so much for having me here today. This is such a great group of presenters and panelists. I just can't wait to hear the discussions that come out of today. And I also wanted to say thank you to the World Innovation Summit for Health and Nursing Now for the Nursing Now Global Solutions Initiative. It's just such a great opportunity to highlight the many innovative ideas nurses and midwives are discovering to address climate change. And I just can't wait to see what the winning ideas are. So here we are today. We're on our planet, Mother Earth, our common home. She is home to over 7.6 billion people. With modernity, science, and public health interventions, we now have fewer people living in poverty. In the past 50 years, life expectancy has increased by 20 years or more. And there's been a decrease in children dying before their first birthday. There is hope for a better, healthier life for more people around the globe. Unfortunately, many of these advances have not come without a price. We now have millions more vehicles on the road, more polluting industries, And our modern conveniences and necessities require more and more energy to be produced, often by burning fossil fuels. Many of the ingredients in our everyday products are petroleum-based as well. These ingredients are used in plastics that become so ubiquitous, not only in the bottles that we use, but in the many single-use plastics we use in healthcare. All of these increase the amount of pollution and greenhouse gas emissions being released into our environment. These emissions are leading us on a trajectory that, unless we take action now, may lead to a very different life for us all. These emissions are now driving the climate change that we all face. We now know that our planetary vital signs are showing a planet in distress. We are faced not only with climate change, but also with declining biodiversity, loss of tropical rainforests, lack of fresh water, and increasing frequency of natural disasters like wildfires and hurricanes. Changes to our natural life support systems are already impacting our health and the health of those we serve. These ecosystem transformations are projected to drive the majority of the global burden of disease over the coming century, impacting the vulnerable and future generations the most. We, as nurses and midwives, with our holistic approach to health, recognize that everything is connected. The health of the planet directly impacts the health of people. And we now know that we have no time to waste. Climate scientists have been saying that in order to mitigate the worst effects of climate change, we need to keep the global average temperature increase below 2 degrees centigrade. However, in an extensive review of climate change research released in 2019 by the United Nations Intergovernmental Panel on Climate Change, they found that there's significant differences in environmental impacts and resultant health impacts if we're able to keep the average temperature change below 1.5 degrees Celsius. And we need to accomplish this by 2030. For example, if we're able to keep the temperature change below 1.5 degrees Celsius, half the number of people globally will experience water scarcity. And instead of 37% of the world's population being regularly exposed to severe heat waves, we'll be able to cut that by more than half to 14%. Climate change is not only one of the biggest threats we currently face, but also one of the greatest opportunities to improve health. And as nurses, we can lead the charge for strong climate action now. We're the largest portion of the healthcare workforce, and we're in every community. We have the skills and knowledge needed to be leaders in addressing climate change. And with this, we have the amazing opportunity to radically improve the health of billions of people right now and improve the health of generations to come. Nurses are creative problem solvers. We use these creative skills every day when we're taking care of our patients. And now we have a wonderful opportunity to be acknowledged for this innovation and creativity. And I'm so excited to be here as we talk about the WISH-sponsored Nursing Now Challenge Global Solutions Initiatives. This is such a great opportunity for nurses from around the globe to showcase their innovative climate change ideas. And I cannot wait to see what ideas you all come up with. Thank you so much for having me here today.
Thank you, Kate. Way to start this session, and we're delighted that you're part of this community and on such an important issue. Thank you so much. We're now going to hear from Dr. Patricia Butterfield about how nurses can shape the climate change agenda. Patricia is Professor Emeritus at the Elson S. Floyd College of Medicine at Washington State University. She's the lead author of a recent BMJ and WISH paper titled Nursing and Climate Change, Meeting the Moment. And she joins us from Spokane, Washington State, where she, as actually Katie before her, is interrupting the long US Independence Day celebrations to join us. So thank you both of you for taking this so seriously and joining us today. So Patricia, if I may hand over to you.
Thank you. It's a pleasure to be invited. It's an honor. I looked at the bios of today's panelists. I really look forward to the conversation. There's some remarkable backgrounds here, and I look forward to your input. I'd like to, my co-authors on this paper are Dr. Jeannie Lepers from UMass Amherst and Professor Maribel Vasquez-Diaz from Chiclayo in northern Peru. We've worked together on this. Some of you have heard this paper summarized before, and you can find it. I'm going to speak extemporaneously for 5 minutes, and then so I can emphasize more the actionable parts, the recommendations. So really, this paper kind of comes down to 3 reasons and 5 recommendations. So the 3 reasons is that nursing was an early adopter and really came to the table early on climate change. If you look at the paper where we summarize the work in this area, beautiful, important work has been done for nursing for 25 plus years. If we expand and accelerate this work, we have a great opportunity to tip the conversation internationally. The 3 reasons for nursing involvement is: number 1, we comprise 60% of the global healthcare workforce. Number 2, among professions, not just health professions, but engineers, other types of things, nursing is oftentimes the most trusted profession. So the ability to give messages that are kind of uptake by those that lack trust is a huge problem in the United States right now. It's really just a very, very divisive situation. And nurses, I think, oftentimes can craft risk communication messages around that. The 3rd reason is our proximity to people most affected by climate change. So once again, those are 3 reasons why nurses can play a somewhat unique role as an accelerant at this moment. So then in the paper, we proposed 5 recommendations, and I'm going to talk about them a little bit differentially because of the audience today and what you're doing, which are action statements. The first recommendation, and I wanted to bring up the quote. This is the quote that stays with me from the Lancet countdown. It will take the work of the 7.5 billion people currently alive to ensure that the health of a child born today is not defined by a changing climate. And that's the tape that plays in my head almost every morning here. So the recommendation we have is to accelerate change by leapfrogging nurses into leadership positions. I have very specific ideas about what should be included in climate change leadership-based programs, mostly because I've lived so many of these things, beginning my dissertation in environmental work at Oregon Health Sciences University in the late 80s. So, a lot of that in terms of having your work dismissed in different ways, gender, proximity, power issues, but I think there's some great opportunities to do leadership programs that catapult on the incredible global work of nursing now, which is how amazing. The second recommendation is to give nurses and students the skill set they need to create the future. I'm going to play this one down. A lot of it has to do with curriculum in both professional development and undergrad. And I think that's a little less the focus today, but there are some structural elements that we recommend specifically around hard locking nursing skills in risk communication. I mean, the real kind of full cargo risk communication skill set that nurses need, probably a little less therapeutic communication too. Number 3, rekindle activism, advocacy, and relentless truth telling. And I was the one on this paper that really talked about Greta Thunberg and others as emblematic of this kind of restless role of activists that are tired of being placated. They're impatient with climate deniers. They're like, let's just not even go there in terms of that. But I think this is a reality check for me. I've been in decades of kind of policy discussions, but to be confronted by younger people and say, we've been talked at enough, show me what the change is and show me when it's going to happen. That's pivotal. So honoring the activism and using activism as an accelerant, I think is very important. Number 4, assure a global viewpoint. We really looked at the literature here with this incredible opportunity to write this BMJ analysis. And really, I think historically, but a lot of that slants to a Western and wealthy perspective. And I think some of it is just the state of the literature at that time. There really needs to be a full emphasis on recalibrating the table so that everyone has a place at the table. And even in the last seminar through the Cutter Foundation and WISH, to hear and learn for me is so important. And just seeing the convening group in terms of what's happening with WISH, I think is just beautiful. And then our final recommendation is to make equity, justice, and morality front and center. We had a lot of discussions about the Pope statement, about a number of theological statements, and that oftentimes nursing has kind of pulled back from that. I think nursing is known as effective bearers of moral dignity, and the public is very comfortable with us talking about right and wrong. We shouldn't shy away from that, nor should we shy away from people that say, perhaps this isn't nursing. So those are our recommendations. I hope you will carry those forward and make them your own. That's what today's discussion is about. I really look forward to it. And then the last thing I'll say is another quote that's important to me. I saw it on an email from Peggy Chin, and it said, "The future will ask, what did you do?" I think about that individually as me as a human being, and I think about that collectively as us as a profession. Thank you for the opportunity to speak today. Back to you, Nick. Thank you.
Thank you so much, Patricia. And those 5 points, I think they really help to shape things. I see that Katie has put a link to the paper in the chat. So thank you, Katie. See, everyone works together as a community here, which is lovely. Now, talking of that, you referenced, Patricia, a quote there, which came from the Lancet Countdown. So what a perfect segue into our next speaker, Frances Mcguire, who is policy manager at the Lancet Countdown on health and climate change. Now, published annually, the Lancet Countdown, if you haven't hunted it down, then you really should, is an international multidisciplinary collaboration dedicated to monitoring the evolving health profile of climate change and providing an independent assessment of the delivery of commitments made by governments worldwide under the Paris Agreement. Frances herself is passionate about this topic. Before we started this session, she mentioned that this has been something she's been working on for a long time. So it gives me great pleasure to hand over the baton to her. So Frances, over to you.
Thanks, Nick. Thank you, and hello. Thank you very much for inviting me to present. Yeah, I've been working on climate change since 1989, so that's a little over 3 decades. And I've worked from an academic perspective, looking at the impacts on farming and ecology and water resources, with NGOs, largely about building support and understanding and looking at energy issues and renewables and such like. And then I trained in public health, and I now find myself at the Lancet Countdown working on climate change and health. I have done a few slides, so I'll just see if these work. I'll just put it up there, and just let me know if the screen's sharing okay, because I sometimes have problems with this. I don't know if that is going to work actually. Can you see the slides, or can you just see my slide channel? Can you see the slides?
Yeah, we can see the slides.
Yep, excellent, thank you. Right, as Nick mentioned, this is the Lancet Countdown. We produce an annual report now that comes out just a bit before the UN Framework Convention on Climate Change meeting, the COP. This year, COP26 is looking to be a key meeting in the process, and will be in November in Glasgow, hopefully. We work with 38 partners around the world, so a wide range of academics from North and South, and WHO are involved, and WMO and the World Bank and the UN. We've just mentioned this, but this came across my desk last week, and it's a picture from Oregon, a Reuters picture, and it's a picture of one of the cooling centres. And this really struck me and indeed is still, very much in the forefront of my thoughts. The events in Canada as well, in terms of very high temperatures, and also Pakistan, that are being recorded right now. But this picture just captures what happens when we get too hot. And where we're at now is that we are seeing many of the projections that I was involved in back in 1989. So work I was doing that was telling us what it would be like in 2035 and 2050 and 2100. We're now beginning to see some of those temperature extremes off the back of an average global rise in temperature. So just really briefly, in case people don't know too much about climate change impacts and health, it's not overly complicated. This graph simplifies it. It also then makes it a bit more complex by chucking in lots of arrows. But basically, as the planet warms up, it will affect humans and our health, either through extremes of heat. It'll affect them. Some populations are more vulnerable than others. We can expect to see, and indeed are seeing, more wildfires, increased floods and droughts, and more extreme events. We can expect to see changes in suitability of areas for certain vector diseases, so increasing ranges for mosquitoes that might be carrying malaria, and impacts on agriculture and water resources, which will all affect food security and supplies of terrestrial and marine food. All of those things can lead to migration and displacement of people, as also can rising sea levels, which can drive coastal erosion and flooding. So those are the sorts of issues that we're talking about when we talk about climate change and health impacts. And within the Lancet countdown, we look at a number of indicators, currently 43 different health indicators. And just taking one, and I will only talk about this one for now, but do go and look at the reports. They're all online. If the report looks a bit complicated and too much to go through, try and find a policy briefing which summarises the issues, usually into 2 pages or 4 pages. And looking at heat-related mortality, this is showing where heat-related mortality is increasing or has increased in people over 65 years. So you can see the darker area, China, Japan, India, the US, and then other regions in between, everywhere obviously experiencing increased heat because temperatures are increasing as greenhouse gas emissions continue to increase and we fail completely to turn them around. So the conclusion of last year's countdown report was pretty bleak, actually, and this was at the same time as we're all still coming out of a pandemic, which we then actually went into a second wave of in the beginning of this year. It revealed our worst outlook for public health since inception, and that no country is immune from the health impacts of climate change. And unless urgent action is taken, it will threaten lives and livelihoods and compromise hospitals and clinics. So there's no doubt that this is the time for action. We really are past endless discussions around climate change, although obviously we have another discussion here. But the whole point of this discussion is to inspire people to think about what you can do and who you can work with to make change. So I spent a little bit of time thinking about this morning. I'm not a nurse, not a trained nurse, and so I don't want to suggest what interventions you might suggest because it's not my field, but my mother was a nurse. She was the first professor of nursing for Wales and she was a registered general nurse. I was very proud of her role in the nursing community. And so this has inspired me to have a little bit of a think today as to how would I approach this. And I started to break it down into mitigation, which is cutting greenhouse gas emissions, adaptation, which is how do we prepare for a hotter world, and education and advocacy, change agents. How do you actually drive those changes? And out of that, for me, dropped some key issues. So under mitigation, you develop specific interventions to cut carbon. So that might be medical and pharmaceutical supplies. You might look there. You might look at transport, patient and staff need. You might look at meals, patient, visitors and staff. You might look at hospital and clinic waste. I'm asthmatic and I have inhalers. I've had them since I was probably about 7. So that's nearly 50 years worth of inhalers. And this is just 2 years worth that I keep in a bag. This is just me. If I had all 50 years worth of all my medical treatment, never mind everything else I've had in my life, a couple of babies and all those sorts of things, if I kind of could scale that up to the amount of waste that comes from medical conditions that are affected by climate change, whether that's air pollution or by perhaps heating, you really would start to get a feel for what the issue means. Under adaptation, there's the possibilities of integrating natural solutions into hospitals and health clinics, building design. So that might be trees to provide cooling around hospitals, in the areas within hospitals, which will help provide cooling, but also then is a carbon sink. Now, you're not going to stop climate change just by having a few trees outside the hospital. But if all hospitals and all clinics were designed, new ones were designed with some shading incorporated, that is going to help. Without a shadow of doubt, that is going to help. It will provide shade. It will provide ways of conserving water. It will help absorb some carbon, also absorb some pollutants. So depending on where the hospital or clinic is, can have a huge impact. And then finally, how do you convince others to do these things? How do you convince others to develop interventions that will support mitigation or adaptation? And that's around building awareness and advocacy. You might want to be an advocate for this issue by learning more about it, by reading around it, by starting to look at the kinds of channels you can look or use in your institution. So that might be a hospital radio, it might be TV screens in the waiting areas, it could be information sources that, so for example, Healthcare Without Harm generate. You might work with the wider health and climate change community, Royal College of Nursing in the UK, NHS Net Zero also in the UK, that's the Green NHS, there's the GCHA, Global Climate and Health Alliance, MSF, Médecins Sans Frontières, and there's a London to Glasgow bike ride planned for COP26 for this year. So there's lots of places you can get involved. There's three key sort of ways, thinking about cutting emissions or adapting to a warmer world or building support for action. And those are just perhaps some of the areas that you might think about quite specifically about a specific intervention. But what intervention you want to design and how that takes you forward, that's definitely over to you. Thank you.
Thank you so much, Frances. I think that last slide there can give huge amounts of inspiration to people who are thinking of taking part in this challenge, or can kind of feed into some ideas people already have. So thank you for giving that some thought yourself. Really, really interesting stuff there. We are recording this session, so you will be able to go back and find everything that's being discussed here, everything that our great speakers are talking about. So you can do that. And those of you who are taking part live in this discussion, don't forget you can go to the Q&A if you've got any questions at all that you have for any of our speakers, then please do feel free to put those questions in the Q&A box on the screen. So we move now to somebody who's actually, I suppose if we're talking about where health and climate change intersect and how health is at the heart of climate change, it's great to hear of initiatives from entrepreneurs where they've been able to make a difference. Now, our next speaker isn't a nurse, but what he's doing is so well fitted into what we're discussing here today. So let's hear from an entrepreneur who's making change happen right now. So Nonso Oporum is co-founder of SoSo Care, and I'm very pleased to say he's the winner of the Wish 2020 Innovation Competition, held as part of our. He's now going to share his experience in dealing with a serious environmental problem in a way that has really improved and continues to improve access to health in his home country of Nigeria. So Nonso, I hand over to you.
Thank you very much, Nick. It's great to be here. I think when I was listening to Frances making the presentation, she raised a couple of plastics that she has used over time. And whenever I see plastics, I think of how this thing is now like a financial coin that could help people offset their medical insurance. My name is Nonso Oporum, and I'm the co-founder and growth lead of SoSo Care. Actually, in 2019, I was going to Geneva for a training, and I was at the bus station waiting for an Uber to pick me up. It was a hot afternoon, around 2 o'clock. I saw a couple of kids, about 3 of them, picking plastics. Then I was working a telemedicine solution that could allow people to consult a doctor online, talk to doctor via the telephone. But when I saw kids picking plastics, I asked them what they were doing by that time of the day. They told me they were picking those plastics for their mom to sell those plastics and get some herbs for their sick brother. At that moment, I knew that everything I was working was flawed. It was not going to work. And I was trying to help over 100 million people in Nigeria who live below poverty line, who are disconnected with healthcare. But I forgot the importance of, I forgot that data and smartphone was a luxury. And most people cannot even do telemedicine because they don't have internet and they don't have smartphone. So at that point, I thought of how best can we solve those big problems? How can we provide accessible healthcare and affordability? I looked at the environment. Waste was piling up. Nigeria generates over 30 million tons of waste and over 30 billion plastic bottles, of which less than 5% of these things are collected and recycled. And when it rains, these things block waterways, turning into breeding ground for mosquitoes, which are vectors for malaria, which claims over 200,000 lives every single year. And claims over 55,000, every year 55,000 women die from simple cases of pregnancy and childbirth, of which could be averted if they had access to quality healthcare. Again, we looked at the healthcare system, less than 5% of Nigerians have health insurance. So both those problems were big and catastrophic. We thought of how best can we use one of the problems to tackle the other problem so that people will not feel that insurance is an expensive luxury. They could afford it using their recyclables as a form of payment. Then we created social care. Over time, I think in 2019, we did a pilot to see if it's going to work. And within 6 weeks, we have about 96 people dropping recyclables to us to enable them access care. And at that point, we knew it's going to work. And we rolled it out late 2019. And since 2019, we've been able to cover over 2,000 people. Currently, we are rolling additional 6,000 people using municipality waste from our environment, a state where we've partnered to recycle 2,000 tons of waste, which will ensure additional 6,000 women and children. Our goal is to create more awareness on healthcare, importantly, reduce maternal and child death, because millions of children don't even live to celebrate their 5th birthday. And these cases could be averted if they had access to quality healthcare. So it's been our mission, but the most important thing is that while we are trying to solve the problem of healthcare, it's like we're also solving another problem, which is climate change and pollution, because these both works are interconnected, because it looks like now you cannot solve one without the other, and there's a correlation between two of them. There is poor waste management system is very poor, and access to healthcare is very low. So by combining both systems, we are able to provide people access to healthcare across over 1,000 hospitals and healthcare cover of over $1,000. Recently, we rolled out a life plan, which provides people cash back of $500 in case of emergency, critical death, or conditions like this. This was part of our experience from one of our off-takers that take recyclables from us, Mr. Mustafa. So when Mustafa went to bed and couldn't wake up, we knew that his family is likely to move back into poverty. So we designed a low-cost group life cover where people could donate as little as 350 kg of plastics, roughly 300 pieces of plastic waste, to provide them healthcare cover as well as cashback in case of unforeseen circumstances or death of the breadwinner of the family. So it's our goal to continue to do this. Recently, we got recognition from government of Bangladesh, where our work has been recognized. And now it's our goal to ensure that healthcare becomes, as more people can have access to healthcare, irrespective of their financial strength. So thank you very much, Nick, and everyone here today.
Nonso, it's great to hear how you're effectively fixing two problems with one, and also just getting the message out there as well. You're educating, helping clear up these plastics, and also providing some of these micro insurance policies, which is super stuff. And I believe that the BBC are talking to you today. Is that right? Is it today, or you've?
No, it's on Wednesday. We moved
on Wednesday,
it to Wednesday.
so
there's a 4-day documentary on Wednesday.
So Nonso is attracting attention from around the world, which is great to hear. So best of luck with everything that you're doing, and people can put questions to him in a few minutes. But before that, we've heard 4 great speakers. Now it's time for a quick panel discussion session, for which I'm going to hand over the panel moderating duties to a good friend, Professor Lisa Bayliss-Pratt, the Programme Director of the Nursing Now Challenge. So Lisa, over to you and the nurses from all over the world.
Brilliant. Thanks so much, Nick. And thank you so much to the speakers that have gone before. It's just truly amazing to hear all the work that you're doing. And just to remind people, you know, there are approximately 28 million nurses in the world. And imagine if our agents of change could get every one of those nurses to take some action around this agenda. It could be absolutely phenomenal. So let's have lots of ambition in our plans with this. First of all, I'm going to come to you, Kieran. And, you know, I want to ask you, as your role as a nurse, how do you think you can play a pivotal role in climate action?
Hi, Elisa. How are you? I hope you can hear me. I'm in an area with some ambient noise, so I hope that doesn't interfere too much. Lovely to see you and lovely to meet everybody on the chat here today. Some really, really interesting ideas about how we can go forward, and as well how we can kind of change the definition of nursing a little bit as well. When I was preparing for the panel session today, I kind of asked a few friends and a few people, you know, I mean, what have nurses really got to do with climate change? You know, I mean, we're so focused on healthcare. But I think listening to what a few of the speakers have said before me about how nurses are in every community and we're creative problem solvers. I'm not an expert in climate change. I don't have any great ideas. I'm going to admit to you straight away. But the thing that I have learned from my involvement with Nursing Now is that we're involved in a massive community, and our biggest strength is our community spirit and our ties and our networking power. And you know, if we could take ideas from entrepreneurs and, you know, different people and experts in climate change and spread that message and get everybody on board and be the recruiters of the, you know, the people for change, you know, I think that is our greatest power, to get everybody on board and spread the message, really.
Brilliant, Kieran. Well, I'm absolutely with you on that one. So let's make that perhaps an action for us to take forward, get that network of over 35,000 people engaged to push others to make action. Great. Faith, over to you now. What would your ideas be? What are you going to do?
Sure. Thank you so much, Lisa. And I would like to do this by projecting some visuals that will go back home with people to think about how they can actually do something really impactful as regards to climate change and their roles as nurses. So to me, I think I would categorize this into three ways. One is self-check. First of all, you as a nurse, you are a human being. Ask yourself a realistic question that, am I really contributing to the greener world, or am I really destroying it? This little example is as a result of how can we be able to be examples in the community? And I like this picture from the Kenyan nursing community that was celebrating their involvement in climate change through planting trees. So this is being exemplary in the community, but also as well as nurses, as human beings as well. How are we disposing of our wastes? How are we ensuring that all our environment is green, and how are we engaging our community? So I would recommend a self-check. Go back home, reflect, and think about how it is that you're doing well in line to climate change. So, and in regards to our roles as nurses at work, I wish we could come up with a logo hashtag to a green hospital. Why? The hospitals are very big contributors to waste, and lots of that waste is not really managed well in line to the point of disposal and all that. So how about we say hashtag to a green hospital, in the sense that our hospitals where we provide care are green to the sense that we plant and encourage more tree growing, but also all the waste is disposed of in the right bins and managed rightly. And most importantly, how are we ensuring that we engage the people involved in the hygiene maintenance of the premises to understand that it is more than just picking it up and disposing of away from where people are seeing, but most importantly, how we ensuring that they also appreciate that they are part of ensuring that climate change is existent, and their role is really key in ensuring that that is controlled. And lastly, probably we should play, as Nan says, a very critical advocacy role. I think back here in Africa, back in the early 90s, public health nurses really played a big role in ensuring vaccination is taken up. And as a result, we see so many people who have grown and reached beyond their first birthday as a result of effective public health nursing and advocating for vaccination. So with that, knowing that that premise really works, maybe we can think about how do we advocate for inclusion of climate change advocacy roles in the roles of a public health nurse. And with that, how do we ensure that we advocate for training of public health nurses to have a component of climate change? And also we should really ensure that we do outreaches that sensitize the public of our role as being important to address climate change. So thank you. I hope this sticks in someone's mind to inspire them to do something as a nurse.
Fabulous, Faith, as ever. Over now to Menashe. Your top three.
Sure. Thank you so much, Lisa. And really just to thank everyone for the amazing presentations that we have received today. It really has been just so enlightening, and to be able to hear about solutions that are being done across the world. That's really amazing. And I think for me, as Faith has highlighted, it's really a personal challenge in that as a person, there's a lot, as an individual, there's a lot that we can do and a lot that we should do as individuals. And then also as a community, really recognizing the power that we have in being able to drive advocacy and being able to push the agenda for climate change forward. I am really listening through the session today. I was really interested in Nonso's presentation and how he has been able to bring two solutions together for two different problems. And it also brought to mind the two challenges that we have. And I ended up thinking about what's the possibility of bringing together digital solutions for climate change. So those are some of the ideas that I think people are available for people, and really looking forward to the solutions that will come through.
Brilliant, brilliant, Menashe. And now Amna, over to you in Qatar. I think you're on mute, Amna.
Sorry. Good evening. I want to thank first Nursing Now and Wish for this amazing session. Actually, I learned a lot today from all the presentation. I got new ideas and new things that really I want to start even doing it from what I learned today. What I want to say for me as a nurse, we are seeing the impact of global warming in our patient from the lung disease lung condition we are seeing during this our poor air quality, and from the storms, and we have here a lot of heat strokes. So we are seeing this in our population and our patient, and we are the first liner actually that we are attending this community patient. For me as a nurse, I felt like we need to educate nurses. I ask a lot of people actually about climate change and our role as healthcare workers in general. Most of them, they don't know about the global warming and what is our role in that. So what I feel that we need to educate and train the people about that. We need to have more conferences and webinars that I want to participate actually in that. About climate change, I'm really happy that the nurses are starting doing that and writing articles and a lot of research regarding climate change. Even for our patient, we need to do a lot of education about the climate change and how to prevent and how we can help them to protect themselves from all this climate change, especially now we have a lot of heat stroke cases. That's what I feel, that I need to educate, and we need to put a lot of efforts on that. Even the TV displays, trees outside, it's really like a lot of things. And even our hospital, I think the hospital all over the world, they are the biggest contributor to this to pollution. We are having a lot of medical wastage. We have a lot of narcotics. We have a lot of body fluids and all. And this is really affecting. From Frances, what she shared, that this is small books. Imagine big hospital, how much they will have from this. So I feel I can do a lot really by advocating and teaching, even during like in a smaller group in my facility, and doing it global, like with you people, and share your experience and learn from you. Over to you, Lisa.
No, I mean, I'm sitting here as an experienced nurse, thinking I've got so much to learn with climate change. And yes, I also work at a university where I train student nurses, and I think more in the undergraduate curriculum. We've got sustainable development goals across our university, as many will have, but do we really make them relevant to you as part of becoming a registered nurse, and how you do that? So I think this is just so fantastic that we're having this conversation and all learning together about this. Yes. That it's brilliant. So thank you so much, and look forward to hearing what you do and how you take this forward. We're going to move to Nepal now, to Susmita, to see what your thoughts are, Susmita, as we're progressing this fascinating talk.
Thank you so much. Namaste, everyone. I'm Susmita Bugati, working as a mental health nurse and a psychosocial counselor in Nepal. Talking about climate change, a few months back, the capital city of Nepal, Kathmandu, was once ranked as the first among the most polluted city in the world. The situation was worse here, and there was corona affecting our immunity and lungs, where the pollution added up and more. Like climate change and its effects in Nepal has been always a big trouble since few years, and yes, we are fighting on it too. Many programs are being held, and there are many things that we are working on it. When it came about this webinar, when it's about nurses' role in the field of climate change, when I was offered with this webinar, I questioned myself, what can I do? What can we nurses do to work on the climate change? I went back to the student nursing days few years back, when we were visiting different places as community field visit program for months and studying community health as a major subject in the curriculum for 2 whole years. And the other activities we have learned was to save the globe by small acts like having health teaching to the community people, the school students, by teaching them to stay healthy and by making our surrounding healthy. We gave them the concept of reuse, recycle, safe disposal of the waste, and many more. Now, traveling back to the present, I felt like we health professionals, especially in Nepal, we are exploring less in the field of environment as a health professional. We have the ability and knowledge of working in the community where preserving the good condition of nature is of most importance and priority. We do talk and work on climate change, of course, but just as an individual. So here, while thinking and imagining, what if we unite together as individuals and professionals to talk about climate, its changing situation, its effects on every living being, and the relationship between nature, its existence with us, human, and our existence. So I think bringing some changes in the modality of taking the health and environment hand in hand would surely keep up the impact powerful. So I think the knowledge, the experience we have, and the mass we have, I think if we try to grab all those and give awareness, and as my fellow participants and my panelists have already said, that we can do more. And lastly, I would like to say that I truly believe that nature directly feeds the soul of a person through the path of body and mind. Thank you so much.
Wow. Thank you for that. And now we've got the real privilege of our early career nurses to ask any questions to Nonso or any other panel members. One of the promises that we make with the Nursing Now Challenge is that we're not an echo chamber. We like talking to ourselves in our professional silos, but it's so important that we talk to everybody and we listen and we engage with others. So I'm going to throw it back to our early career nurses now. Any questions for Nonso, and who wants to go first, or any other panel member?
Yeah, sorry. I was waiting for someone else to go first. I was just wondering, since we have Nonso here in the room, is there anything that, from his experience of working with healthcare professionals, and his really interesting work of tackling healthcare with, saving the environment, is there anything that he can recommend for us to do in our daily clinical practice? Because just listening to Faith's discussion, it really, it made me actually think of my own practice. And, I work in an emergency department, and sometimes we're so busy, and, our patient's care comes first, and, sometimes we forget to put the waste in the right bin, or, we forget to do these things that actually have consequences down the line. So I'm wondering, has Nonso identified anything that he would like us to do in our clinical practice that would help drive his project, or all of ours, I suppose, in terms of the environment?
Any thoughts, Nonso?
Oh, okay. Thank you, Professor Lisa. Okay, Sarah, I think your question is a great question. Practically, for example, here in Nigeria, let me give you statistics. Every year in Nigeria, 55,000 people lose their life, mostly women, on pregnancy and childbirth. This is very devastating, because 85% of such death could be averted if they had access to primary health care. And because if you break the number of minutes we've spent here, that means at least 3 to 4 women would have lost their life trying to have kids, even though these things could be averted. Now, a greater part of these deaths don't occur in urban regions and in the city. They occur in rural communities, and because women in rural communities don't have access to quality health care. Recently, what we are trying to do is to empower local community nurses. I think I had a call today with Toleram, and we had a call with Coca-Cola Foundation last week. So what we're trying to do is to empower rural nurses, make them champions, so that they could also provide simple healthcare and be able to incentivize. Like we have traditional birth attendants in communities who help deliver children. What we try to do is to incentivize these traditional birth attendants to recommend women to visit hospital after delivery, to ensure that we could reduce the chances of mother and child death. So these are things that we look at. And importantly, what we do is, I believe in, if you come from a developing country like myself, you understand that you face so many limitations. You face limitation with resources to do what you want to do, and you face limitation with the ability to scale, maybe because of infrastructure as well. Because thousands of people don't have smartphone, you have to think of ability to enable them to access this thing. Recently, what we're trying to do, we're trying to use a coordinate. So the way Uber works, people, instead of having people with smartphone, they could still have normal phone and be able to, a middle class person like you may not really need plastic to access care, but you could order a plastic from a woman that lives around the slum around you to simply come and pick those plastics. So for us, we look at alternative ways of creating inclusion for people, and importantly, protecting an environment. And importantly, as a nurse who is trying to come up with a solution, you face so many challenges. It's not always good about the success stories. You also have to look at the failure stories. That is where you learn, and that is where you can get more knowledge to do what you want to do. Because it's on the failures that you can find gaps and be able to fill those gaps to deploy what you want to do. So for nurses who come from developing countries, I think that is where the bulk of the work is, because there are limited access to healthcare, more healthcare professionals are needed. So there's a huge gap in healthcare. So you see a nurse has to multitask, a nurse has to sell drugs at the community, a nurse has to provide care in hospitals. Nurses can as well improvise, think out of the box, create solutions which can scale in their own limited capacity. When we started social care, our mandate was just to provide healthcare to our capital city in Abuja, but we see that we have more calls coming from, recently we had a call from Haiti, We've had support from Bangladesh, which we're also trying to replicate because we are eyeing $100,000 grant from them. So which we're also planning to replicate there. So you could start small in your community. You could come up with an idea. There is nothing wrong with trying something and failing, but it's the ability to even not delay, to get into it without excuses and implement it. That is the only time you can learn and be able to improve on what you're building. So
Brilliant.
Thank you very much.
So that's just fantastic advice. Time is getting tight, but is there anything else any of our early career nurses want to ask, or are you all okay? Sounds like they're all okay. So I think, Nick, now it's back to you, and it looks like we've got some great Q&As in the box as well. So thank you so much for allowing me to moderate the panel. It was fab.
Thanks, Lisa, and thanks all the panelists there. Just highlighting coming from Ireland, based in the UK, Uganda, Zimbabwe, Qatar, Nepal. So really great to see that mix of people. And yes, we do have some questions, which I'm going to try and rattle through, and I hope I can see them okay. So the first question is for Dr. Patricia Butterfield, which was in the chat from Jessica Edwards, that mentions you spoke about honouring activism. In the UK, the government wants to bring in new police crime and commissioning bill, which will give police forces the right to detain and charge individuals for protesting. And Jessica's question essentially is, do you have any advice for those of us in the UK who want to be activists for the environment and protest, but fear the punishment, a concern there that nurses may keep away from taking part in protests for fear of being accosted for doing so?
Sure. This is a great question. This is really important, and it's a theme that came up in the discussion last week with WISH, which really has to do that everyone lives in their own cultural context and needs to take appropriate precautionary behaviors. I think people need to make those decisions on their own. And that's been something I've struggled with my whole life. Granted, coming from this nation and being an academic, I have quite a bit of freedom, but frankly, now that I'm an emerita faculty, I feel much freer to take more sharper stances that I think are true to my own conscience. I can't answer that for nurses in other nations because that would be arrogant for me to do that, other than to weigh those consequences. There are risks. There are risks in terms of developing a police record or other types of things. And it may not be the time for you to go there in terms of that. There may be other outlets in terms of policy development or advancement of green teams in your facilities or other types of things. On the other hand, other nurses may decide to, kind of dig in with both feet and really embrace the political aspects of really being a climate action accelerant, knowing that there are risks that come with that. Thank you. That's a brilliant question. And I think something we're going to be seeing a lot of as we see kind of, there are many places, the US certainly included, that has a very polarizing discussion underway. Thank you.
Thanks, Patricia, for answering that. I'm going to warn people before I put questions to them. So the next one is coming to Katie. And it's from Dorcas Gawata, who is the head of global programs at the Florence Nightingale Foundation. So great to hear from you, Dorcas. Nurses have a good social contract. How can nurses and midwives leverage on this social trust to push the climate change agenda relevant to their context? Could nurses advocate for clean and safe water, for instance, for communities, or for gender equality, reduce forced migration factors? This is something that Dorcas is asking. And Katie, if I can hand it over to you.
Sure, that's a great question. And I think yes to all of those. I think any type of environmental issue, nurses can have a really important and powerful voice, whether it's talking with your colleagues about these issues, talking with your hospital administrators, getting engaged in the policy realm. It's pretty amazing. I bring nurses to speak with elected officials all of the time. And one of the recommendations that I have is, you know, when we're talking to them or one of their staff members, we always ask, do you have a nurse in your family, or do you know a nurse? And 99% of the time, they have a close family member or friend that's a nurse, and you have this instant connection. And so it just creates such a powerful opportunity to create change. And with the gender equality issue that was brought up, it's gender equity, which includes educating girls and access to family planning, are two of the best ways that we can address climate change. I put in the chat earlier about nurses drawdown. That's one of our issues that we're working on with that, because it does have such positive impacts both on the health of those families as well as on the health of the planet.
Thank you. I've got a question here from João Marcel Grillo. I hope I pronounced that correctly. Probably didn't, apologies. They're a mental health nurse in the UK, and they have a question which I'm going to put to Frances Mcguire. No, let's just get that question back up. Could there also be a role for us to influence healthcare related policy makers to incorporate the theme of climate change and biodiversity into the nursing care agenda? For example, in Japan, there's a growing tradition of prescribing forest walks to people experiencing high levels of stress and even trauma. Could such forms of therapy, in which nature is seen as a therapeutic partner, be encouraged by nurses and incorporated into policy and evidence-based care? So incorporating the environment into what you do. Frances, I'll send that to you.
Yeah, I mean, definitely already happening actually under social prescribing. So a growing interest and recognition that access to nature or access to sort of activity like, well, dance, community activity, just gathering people together. But I say particularly so in terms of mental health, particularly people who are perhaps isolated and are not getting out from the home and are very much on their own. So it's an area that's been, you know, it's under discussion for a while. I would love to see some data on how many GPs are prescribing social prescribing. And I think there is some data, because I think some are, but I don't know whether it's scaled up so that it's something that all GPs can kind of automatically look at, and how that is then supported through, say, community psychiatric nursing, or supported in hospitals by nursing staff. In terms of, I mean, there's been, for quite some time now, there's been discussions around how wards should be better designed so that patients can see out to nature and they're not looking at dirty, grimy windows, but they're looking at green space, and ideally better than green space, high quality natural environment. So that's a mixture of, you know, trees, flowers, that's attracting wildlife, bees, birds, you know, as good as you can get it, really, because the more complex an ecosystem is, the more interesting it is, and consequently the more pull it will have for people to lift mood and to lift spirits. I don't want to oversimplify it though either, actually. Somebody who's, you know, really suffering and with severe psychiatric distress may need more than nature prescribing, but there's gradations, I think, and that somebody who's perhaps experiencing low levels of depression or anxiety or stress could benefit. But it's really a question of what the systems could start to be in place and how to scale those up so that health professionals, whether that's doctors, whether that's nurses, feel confident that that's an intervention that they can design and implement.
Thank you. Thanks, Frances. I'm looking now, and let's see. So Mary Ellen Potts has asked, and I'm going back to Patricia now as an educator here as well as a nurse. What would be helpful for me as an educator and researcher in nursing is to break down ideas from micro to macro levels, e.g. from including climate health in nursing curriculum undergrad and grad levels to institutional policy and beyond levels. Any roadmaps that you can recommend on that? And also, how do we as instructors help students to manage the emotions, the personal emotions of grief, anger, shock, etc., that can arise from this knowledge of how health is affected by climate change? So Patricia, can I Can I throw that one over to you?
Thank you. That's an important question, addressing kind of the philosophy of the curriculum. I think one of the things that I found helpful, and there are a couple of roadmaps on this, but you can just kind of do it by the seat of your pants, is essentially curriculum mapping. You can do what's called curriculum insertion points, where when you're developing your curriculum map, you can look at what are logical insertion points. We talked for climate change information. We've talked about this before. It could be in the community health assessment course where you're talking about ambient air quality and the prevalence of asthma and triggers. You can be talking about this in the emergency response portion of the curriculum. But oftentimes there are less traditional opportunities for curriculum insertion. Something we talked about previously was the mental health consequences in the Pacific Northwest. The effects of both the heat and wildfires has had a significant mental health overlay for people, especially in local data collection, finding things, especially young families where their children need to be confined in the home for extended periods of time, and the children are not outside, the mental health consequences for the children as well as the parent. So if you wind that back into curriculum development, there's many opportunities. There are some maps to do this. I worked with NEETF many, many years ago, and we developed curriculum insertion points for, I think that was pesticides, but you can do this just in your own bootstrap way. I will say what I think the greater challenges are faculty. I'm just going to say this as a dean, and the idea of getting past this added curriculum that you just kind of pack everything into it and nothing can go, and because that really isn't a way to teach. And so if we talk about paradigm case stories of change and impact of nursing, that's an opportunity to address issues of climate change. And it doesn't need to be at the expense of other things, but there's a lot of ways. And then the last part of that question, which really had to do with kind of the emotional response. And frankly, I'm shocked as someone that's given presentations on climate change for many decades. I remember turning to the board and being shocked by my own material. I mean, it's really quite powerful to see, what has come to reality. And so I think debrief sessions for students and building that in, these cannot be, content heavy sessions and then everyone's, runs out in the hall and moves on to the next thing because it does not provide adequate processing. But if there are debrief sessions and then also a loop back in the next class session where there's an opportunity for people to do that. And then I think the pivot, we've talked at people around climate change for a long time. A lot of the early nursing information has been descriptive and narrative in nature rather than actionable. And I think the way that people work through their anger and their rage and sadness and grief is exactly what Nursing Now Challenge is doing, which is for people to formulate small projects that fit in their community and beat at the wall of change, no matter how difficult that is. Thank you for that question.
And thanks for that great answer, Patricia. Great having you as part of this, as always, and equally great to be able to put the question to Katie, speaking on behalf of the Alliance for Nurses for Healthy Environments. This seems to fit with you, I think. From Lucy Hayes, I wonder if anyone has any thoughts on how to be heard. So I've decided that anyone is you, Katie, has any thoughts on how to be heard at a higher level on these issues, especially if you're a student nurse or an early career nurse who's still finding your place within a healthcare organization. So how do you get yourself heard?
Yeah, this is a great question. And I think climate change and other environmental health issues within healthcare are fabulous opportunities for nurses to gain leadership skills and to make an impact in their local communities. I would say first to look and see, who else in your institution is interested in doing this type of work. There may be some mentors within your healthcare institution that can help guide you towards gaining more leadership skills, being able to speak with some of the executives at your hospital, higher level managers. I would even just maybe start speaking with your nurse manager and talking about some of the issues that you're interested in. I have a number of nurses that I've worked with over the years that have done that, and they've been able to make some really amazing changes that first started on their unit and then spread like wildfire to other units because they're like, wow, this is really cool. These initiatives that you've started on this particular unit. So, you know, find that area of passion and then find your colleagues that can then you can support one another. So I would see what's going on first in your hospital and then spread out from there. And finding those champions that can work with you, you know, even if it's just a couple of other young nurses and you're all trying to figure it out together, it can be a really great way to start.
Great. Thank you, Casey. Amna mentioned and also Francis mentioned, so I'm going to come to you, Francis, about packaging. And Natalia is asking if there are some global proposals to advocate with the pharmaceutical industry to introduce some recycling packages, at least the main items that are used in hospitals, fluid bags, things like that. Francis, do you know from your experience if there are any link-ups with the pharmaceutical companies or other bits of the industry where maybe nurses can be advocating not just for what other nurses do, but for what happens across the wider health community? That was to Francis.
Sorry, as usual, one person always unmuted or muted. Sorry, I don't have any detail on that right now. The reason I showed the bag of inhalers was to emphasize the point that the greenhouse gases from fossil fuels it's the same source really of pollution that causes air pollution. So you've got burning coal, oil and gas, creating greenhouse gases, driving climate change, burning coal, oil and gas, causing local air pollution. For anybody who hasn't really understood climate change and still finds it complicated, it's quite reasonable to think about local air pollution and think about how that affects health. And it's really obvious. We all know and can feel when air quality is very poor. If you have asthma, you're even more sensitive than most people when you're breathing in poor air quality. And it maps across fossil fuel use and agricultural practice and biomass burning. So there's a map across between climate change and air pollution, which is why I kind of flagged up the inhalers, because as a person with asthma, I'm both very sensitive to local air quality, but see how that fits in the bigger picture of climate change and the sources of greenhouse gas emissions.
Thanks, Francis. I suppose following on from that, if Natalia, you think that's something that should be taken forward, then maybe that's a suggestion for a Nursing Now challenge around this, you know, how to better integrate with people who are producing the packaging that we're overusing. We're coming towards the end of this session, and I'm just checking through a few things now. Christine Kennedy, now this is one I'm going to throw open to the panelists, the people who were talking with Lisa a little while ago. Are others doing intentional links to climate change within primary care visits, is what she says, and uses an example from Chicago. One nursing practice action we're doing at Rush U Nursing, is in the 30 community clinics we run in Chicago low resource urban communities, tying health equity with primary care, e.g. the impact on health, stress, asthma, etc. Also collaborating with design, low-income housing architects, and she puts a link there to that. So I'm just going to probably round off this session by going to people and seeing if any of you are seeing any examples that you might want to share that are going on in your communities, anything that's happening in the places where you're currently working. Are you, you know, we're talking about hopes for the future, but obviously this climate change crisis is something that we're dealing with now. So has anybody seen anything that's that's going well in their communities? And if not, do they have any suggestions for what should be happening in their communities, in their institutions, sorry, rather than their communities?
Yeah, thank you so much for this opportunity. Yes, in our community, I'm working in an organization named Joy Mental Health, or Unity in Health. There we are working in a eastern part of a hilly region of our country, that's Ilam. And especially we are working there as a mental health camp. We are taking some mental health camps from past 2 years. And recently we are organizing a women help group in that place, where we will be organizing, or we are planning to organize different awareness camps about how we can preserve nature, and how it will directly or indirectly connect us with our mental health. Because we truly believe that, me being as a mental health nurse and working in an organization whose main motto is to work on mental health. So we are trying to connect people, mainly the women, because once the women are educated, we say that the whole community or the whole family is educated. So we are trying to connect them with the nature, because Ilam is such a beautiful place. It's with whole greenery, and also trying to connect them with the mental health aspect. I think that would create a great effect on them, and they can educate their children's and other people out there. So I think this can be one of the program that we are organizing, and we are planning to do it in our country.
That's great. Thank you so much for sharing that. It's always great to hear of examples of things that are being done in the community and going well. So best of luck with that in the future. We're about to close, but before we do, let's just really quickly go around our young nurses and ask a very simple but quite important question. How will you, when you leave this meeting, and for anybody who's watching now, how will you encourage your peers to play an active role in addressing climate change? And I'm going to go through the order that people spoke before. So Kieran, I'm dropping you straight into it. You get to go first.
Thanks, Nick. Well, I'll be honest. When I heard your past question asking if we were involved in anything, I was drawing a blank. So I was trying to think, but I suppose as healthcare professionals in general, no matter if we're nurses or doctors or whoever we are, I think we're always trying to encourage people to be more healthy in their lifestyle. And as you know, healthier lifestyles involves exercise, getting out in nature, leaving the car at home, getting on the bike, all that kind of stuff. So I think, on top of my regular practice of doing that, after attending here today and really reinforcing the importance of climate change in my head, I'll have it in the back of my head when I'm giving advice to patients. Actually, you know what, this is good for your health, but also it's good for the environment to get on the bike and to eat more greens and, all of that. So I think an increased awareness is the best I can offer for now. I'm sorry.
No, that's great, but we've got to put you on the spot. It's important to do that. We're old friends. We can do that now. Talking of old friends, Faith, I'm going to come to you next. So how would you encourage your peers, the people that you're working with, and also the patients as well, to play an active role in addressing climate change?
Yeah, so thank you, Nick. I think my points are really two. First of all, I'm going to really promote #GreenHospital. I feel like I've worked in the hospital before, frontline, low income, high income hospital and all that. And I think we all had a common problem because we really wanted to save the life. We really tried to dispose well, but we didn't do it very effectively. So if we can see ourselves play a role in reminding our colleagues that we need to keep the hospital green and it should be an example in the community, I think that's important.
Thank you, Faith. And Menashe, what will you be doing? You're going to leave this meeting. What's next for you to really push this idea forward?
So
Thank you so
I'm
much,
going to
Nick.
promote the #GreenHospital.
Thanks, Faith. Sorry, Menashe.
Oh, sure. Thank you so much, Nick. And I feel really just having this discussion has been a challenge for myself. And I think one thing that is really going to be key is being able to encourage other young nurses, firstly, to be aware on how climate change has an effect on health, and being able to get other young nurses part of this agenda in driving a movement for climate change amongst health professionals. So I think that's one challenge that's going to be there for me in being able to engage other young nurses in driving advocacy.
Thanks, Amina. Sorry, Amna, you're in, I should know your name pronunciation by now. Amna, you're in Qatar, where obviously climate change is a day-to-day thought. You know, the heat, you're in the summer in Qatar now.
Yes.
What will
Correct.
you say to your colleagues when you leave this meeting about thinking about climate change and health?
For me, actually, I need to use my voice. Ask nurses and other colleagues to join, you know, in many like this webinars and activity. I need them. They need them to be educated also. I want to promote the best practice that benefit the environment, and share all successful story from our friends. The initiative, it's really, we can do it here also. It is really a good initiative, especially we have a lot of wastage that we can do it in this way. And also to take a leadership role in my organization, encouraging decrease wastage and how to be more green and safely disposal. So I feel I can do a lot of things when I will come back. And first thing, I need to ask them how we are disposing our waste and medical wastage here.
That's a really good point. Actually, keep asking that question. Embarrass people into doing something. You know, effectively, there's no shame in embarrassing people to say, "Hang on, what are we doing with this waste? Why are we producing so much waste?"
Yes.
Thanks, Amna. Susmita, I'll come back to you. Final thought.
Thank you again. So after this webinar, I've learned so much from here that I'm amazed that being a nurse, I can work in the climate change also. I'm really amazed by, after searching this and after attending this webinar. So I would, first of all, I would share my experiences with my colleagues, with my friends, with my seniors and juniors, that we can do it. Like we are trying to settle down the wastage in the hospitals and the areas, and we can do it more. And like we can plant more. And the thing that is, I always connected with mental health, that if we think about the change, about the climate, that it's affecting our mental health and the health, then we can be more connected. I think connection is the key, where you can connect the environment and yourself, your soul, your body. And when you feel connected, you work for that. When you love something, then you work for that. I think so creating that love and creating that connection is the thing that will be working as far as possible. Thank you.
Thanks, Susmita. As always, whenever we're gathered with the nursing community and the younger nurses, it's always really inspiring and some hope in what's otherwise quite a tough situation out there. But I've got every faith that nurses will be at the forefront. Of course, my recommendation would be to go to nursingnow.org and sign up to the Nursing Now Challenge and have that chance of $1,000 and speaking at Wish next year. Really great being involved in this today. Time to wind up, really, just to say thank you to everybody who's been part of this, people joining us during the Independence Day break in the US, people joining us from Africa, Asia, Middle East, Europe, all over the world, to all the audience, to everybody who put questions and everybody who took part in this, even listening into this. I ask you to check out the recording. It'll be on the I'm guessing this now, but I think it's right. Be on the Nursing Now YouTube channel. You'll be able to find that quite soon. And check out the publications that have been done around this. Some really interesting work. Encourage Nonso with his success in the future with his project. Let's see more like that. So thank you, Katie, Patricia, Francis, Nonso, Lisa, and our panelists, Hannah, for her behind the scenes work. It's a real privilege to be here with everybody today. So thank you so much. Best of luck with your Nursing Now challenge around climate change and health, to everybody taking part in that. And goodbye. Thank you. Thanks, everyone.
Thank you. Bye.